Hello, and welcome to Let's Talk Climate, a webcast series from ecoAmerica. Featuring dynamic discussions with local and national leaders offering diverse perspectives, Let's Talk Climate brings forth the latest thinking and best practices for building public support and political resolve for equitable climate solutions in the U.S. I'm Rebecca Rear, Director of the Climate for Health program at ecoAmerica, and today we are bringing you a special episode, Ambassadors in Action, Health Advocacy for Climate Solutions. I'm joined today by Dr. Neelu Tummala, an ear, nose, and throat physician and clinical assistant professor of surgery at the George Washington University School of Medicine and Health Sciences. She's on the steering committee for Virginia Clinicians for Climate Action, the board for the Faith Alliance for Climate Solutions, and is on the associate board of City Year DC. She's a trained climate reality leader and a Climate for Health ambassador. Hi, Neelu. Thanks so much for joining me.
Thanks, Rebecca. Excited to be here.
I'm looking forward to our discussion today about your journey as a health professional into climate advocacy and how others can join us. First off, tell us what originally sparked your interest in the ways climate change is impacting our health.
So for me, the biggest initial motivating factor was raising awareness, right? So as a physician, there was not a lot of education about the health effects of climate change. That's changing now. Medical schools are definitely making a push for including climate change and how that affects health into the curriculum. But that was not a part of my training and it was not a part of my residency. So here I am, having spent 9 years on medical training, and I'm going to climate conferences thinking that my role as a health professional and my role as a climate ambassador were going to be separate. And I start to learn about all these different health effects, and everything just sort of merged together. And I realized that if I, as a clinician, was not aware of these health effects, how many other people out there are not aware, but even worse, how many people are being affected but aren't aware of that. And that's really where and why we need to take action.
Yeah. And I'm glad, I know there are groups now working to get climate change and environmental health more broadly into the medical school curriculum. And I know that's an exciting area of work for folks to plug in.
Definitely. I'll do a quick shout out for Medical Students for a Sustainable Future. They're founders from George Washington. And really, it's just about, sort of pushing your medical school to incorporate it into the curriculum. And there's definitely some that are more receptive than others, but I've definitely seen a lot of movement in that direction.
Yeah, agreed. And for health professionals more broadly as well, I know, when I was doing my master's in public health, for example, it was so exciting to have folks who are focusing on maternal and child health or community health, being able to understand the intersections of the way climate change is impacting maternal and child health and community health. The way that it's being integrated across the silos, even in our own professional world.
100%.
And now you're reaching tons of people through your talks, writing, and advocacy actions. The first piece of guidance in our own Let's Talk Health and Climate Guide is start with people, stay with people. So I want to ask you, what have you found to be the most effective ways to engage your peers?
It really is just talking about it, like talking about it all the time. So climate change is considered by a lot of people to be still this future threat, something that's going to happen in the future. But the more we talk about it in the present tense, the more that people realize that climate change is here and it's happening because it is. So I think that obviously I approach educating people on climate change through the health perspective, but if you just talk about climate change as like an everyday thing, and sustainability is a really great way to sort of approach that. So like I have colleagues all the time who are like, oh, where do you buy clothes? Where do you shop? And the first thing that I say as my requirement is I think about where is sustainable, like what companies have prioritized, really like reusing products, creating a circular economy, buying secondhand. And I try to incorporate those ideas as if they're very normal because they are normal. They need to become normal ideas that we think about. And even with travel, it's not just, I'm going to fly somewhere. And obviously with COVID right now, at least everything's a little bit different, but sort of thinking about, okay, like how does travel impacting the environment? And again, not making it as if you're shaming anyone, but just making it as something that we need to be thinking about every single day when we make decisions.
Yeah. One thing you said in there, don't shame people. I think that hasn't worked. There are people who take that approach, and it just really, it sort of perpetuates preaching to the choir when
Yeah.
we invite many, many more people in to care about these issues. And so that's a great point. And another one of our communications guidance is ditch the doom and gloom, and it's sort of that same category. Don't shame people. Start with everybody has a different on ramp, and ditch the doom and gloom. And there are so many positive opportunities for climate solutions. And that's really,
Definitely. And I think there seems to be a disconnect of like awareness of it, right? Like a lot of people are aware that climate change is happening, but they're like, what am I supposed to do about it? Do I have the time to do something about it? It's a really challenging time right now in general. And so how much emotional and mental energy can I put into this? So I think that when you create it as a part of the narrative of daily dialogue, and then also give people sort of concrete, just sort of like sliding them in, like, oh, you could do this or this, that helps them think about it in a way that, again, makes it seem more digestible and doesn't seem as intimidating.
yeah. And um, the question I originally asked you was about how are you engaging your peers? Um, are there other, do you take a different approach when you're talking to, your community or your patients or others?
Yeah. So I would say with my peers in general, most of them do seem to be aware of climate change, which is why I try to create the dialogue in like the daily narrative. With patients and with others in the community, I do try to focus more on the health impacts of climate change just to raise awareness. So talking about it in a way that people understand how it's affecting their daily lives, I think is really helpful. I'm kind of one of those people that won't just say, oh, climate change affects your allergies, but I'll say, okay, listen, like this is how much the world has warmed. So global warming is happening. This is why pollen seasons are longer. This is why the freeze-free season's shorter. This is why, the freeze-free season is longer. This is why the number of like pollen growth is increasing because of CO2. So I really try to go down into the pathophysiology, to use like a medical term, not to like make people, go over their heads, but really to say these aren't just like headlines that we're saying. Like there's concrete scientific evidence behind each of these statements. And let me tell you why in sort of like A leads to B leads to C format. I have found that to be effective sort of in my clinical practice when I'm trying to convince someone that like Flonase really does work to improve your allergies. And so that's the way that I approach climate communication too. I, as a clinician, tend to focus more on the health impacts of climate change. But I think that you can do this with sort of any of the various things that climate impacts, the economy. And it's just, again, it creates that bridge from it just being a headline to why we actually need to worry about it.
Yeah, and I'm actually really glad you mentioned allergies because I think that's the example I give because that's sort of how I've been personally impacted. And storytelling also, we know is so important. There are, I mean, there's a propensity of data out there about climate change and how it's impacting our health, but it's until so we are armed with the data. That's not in question, but it's
Right.
that that translation to our personal lives and stories. And so the allergies one, I also live in DC. That's something that, yeah, we certainly experience here. And it telling that personal story about how I've had more sinus infections in the last 2 years, than the previous 20 combined, I think really can demonstrate how it's. And I've lived in this area my whole life,
Yeah.
so it
Our
really,
allergies are getting worse.
yeah.
Yeah. And there's like three different ways that they're being impacted. And so that all compounds to you having multiple sinus infections.
Yeah, and the ambassadors training, the Climate for Health ambassadors training. Usually, when I'm presenting that, I'll talk about allergies myself, but I'll actually ask others to talk about wildfires. I'll open up the call
Mhm.
because again, living on the East Coast, I watch, and I hear about the fires, but it's just more meaningful when people talk about the ways that it's impacting their own lives, and so that's also inviting people to tell their own stories. And I know, health professionals for climate action, or health voices for climate action is doing that,
Mhm.
inviting health professionals to give those little snippets. So that's another way folks can plug in as well.
Definitely.
Storytelling.
Yeah. There's even a story that I heard from a colleague during the wildfires where she was talking about how she didn't know she had her 2-year-old and she didn't know if she should like keep the windows open or closed to be able to escape the heat versus the particulate matter. And it was just this, really heartfelt story of like the challenges that a mother faces in terms of like what to expose your child to.
Yeah. Yeah. And I mean, people have to make those choices all day, every day.
Yeah.
Uh, and the more we can help, by building equitable climate solutions that help make the healthy choices easy. Like that's what we say, I think, all the time in the medical and public health world is make the healthy choices easy.
Yeah,
And I think that's so true of climate solutions as well.
yeah.
Um, so
To
I,
make them apply to everyone.
yeah, absolutely. And yeah, make them accessible to
Mhm.
everyone. So the Climate for Health Ambassadors Training Program, which I mentioned and you've participated in, trains and supports health professionals in their climate action and advocacy. And we want to make sure we've given several examples already that the work with folks during the training itself, but support their ongoing actions.
Mhm.
And while we absolutely need ambitious and immediate action now, we also know it takes time to educate folks and draft, pass, and enforce legislation. So, what's your advice for people who are just getting started but want to make this a lifelong endeavor?
Yeah. So I think the number one thing is creating a network. So I think this is helpful both in terms of having people that you can talk to about the issues. One of my favorite things about, the Climate Ambassadors Training Program is with programs like that is you meet other like-minded individuals, even if you have to do it virtually. I got to do mine in person, but even virtually, right? Like you're around people that are thinking the same thing, have the same um, motivation, and I think really creating that network to be able to sort of like bounce ideas off of and work together and collaborate is huge, because as individuals we can definitely make an impact, but together that's where the real action happens. It's also part of the reason that I have joined like a few different organizations. So with Virginia Clinicians for Climate Action, that focuses on Northern Virginia, or focuses on all of Virginia, but that has allowed me to approach climate action in a different way. And then the Faith Alliance for Climate Solutions, which focuses on Northern Virginia, that's allowed me to approach climate solutions, not necessarily through a health perspective, but with other like-minded individuals. So it's just a bunch of different networks that, again, everyone's working towards the same goal. I would say the second thing is really self-education, learning about it. If there's not a textbook for how to be a climate ambassador. There's not a textbook for how to be an advocate. So a lot of it comes from within. One of my favorite stories is when I went to go see Jane Goodall. She talked about going to a conference, and she said, attended the conference as a scientist and I left as an advocate. And I think a lot of people who are climate advocates in the health field feel similarly. I definitely do, where all of us are, care about health, we care about public health, it's a priority, but we also have this like fire inside of us that really makes us passionate advocates. And I think that you can be the most effective advocate by self-education. So some of the ways that I have found that are really helpful is one, attending conferences, and obviously ecoAmerica has great conference. But I also, the Hill has like daily energy briefings that I get sent to my in basket, and I read those every day. The Atlantic now has a new weekly newsletter. The New York Times has a newsletter. And then, just kind of getting on a bunch of different listservs, Union of Concerned Scientists, like there's a bunch that may not, have everything that you need, but together creating all of these resources really helps create a more well-rounded advocate.
Yeah, one of my favorites is Environmental Health News has the the Above the Fold newsletter that I get.
Yeah, yeah,
I always skim that. No, that's wonderful. Love the Jane Goodall story. I think that's so true for many as well. And
definitely.
you mentioned already making climate solutions accessible to everybody. Uh,
Mhm,
and we do know that climate change impacts all of us, but impacts communities of color and low income communities first and worst.
mhm.
So how can we continue to address climate injustice and achieve health equity through climate solutions? What are some of your thoughts and ideas on that?
Yeah. So I think the biggest thing is making sure that we are thinking about climate justice as a part of every conversation involving climate solutions. I think that one of the things that has really come to light is that there's such deep rooted systemic issues that leads to environmental injustice, such as like redlining in communities that has made certain communities more susceptible to heat waves. And I think that to really adequately address environmental justice, we have to basically include that as a part of every single conversation in terms of climate action. I have found that with my writing, I try to include it as a part of like every single narrative that I write, because the two are so integrated. They're one and the same. And without equitable climate solutions, that's not helping anyone.
Yeah, couldn't agree more. And I think uh, as health professionals, centering health equity and climate solutions, really understanding that policies that address climate injustice also
Hmm.
are health solutions,
Exactly.
and making that connection really clear for folks,
Hmm.
um, so that we can accelerate leadership and the ambitious action that we need um, on climate.
Definitely. And it's because of systemic issues that have been going on for decades that make certain populations more vulnerable, and we have to address that.
Mhm, mhm. Well, thanks so much, Neelu, for the fantastic discussion and for the examples of actions and ideas that you've provided that others can take too. Last question. It's the end of 2020. We're recording this in November. It's the end of 2020, and it's certainly been one heck of a year. And we're heading into a season of giving and thanks. So, what are you reflecting on or thankful for this year?
Yeah. So, this weekend, I'm celebrating Diwali, which is the Festival of Lights, is known as like a new beginning. And I'm feeling a lot of inspiration with that sort of idea. We are entering a new season. We do have a new administration who has, talked a lot about actions that are going to be taken for the climate. And so I think that there's just a lot of motivation right now in terms of the future for climate. I think the other thing is that we still have time to make a tremendous impact on the climate. I think that some of these ideas of it's too late, that's not true. Climate scientists are very clear that we still have a ton of time. And so that's very motivating because there's a lot of people who are growing awareness of the climate crisis and are taking action. And together, I really do think that we can make an incredible difference in the future and for future generations.
Yeah, again, couldn't agree more. And thanks always for ending on a note of hope and inspiration. I think we could all use a little bit more of that. So appreciate the time that you've spent with us today, uh,
Definitely.
and to share your wisdom and concrete actions. And let's make sure we're all following through on your advice to talk about climate. And make climate solutions part of our everyday actions and decisions. And by modeling that behavior and talking to others about the that it just makes us feel good. I think that we can help others do the same. So I just wanted to end by inviting everybody to join us every Thursday for live episodes of Let's Talk Climate. Engage with us online with the hashtag Let's Talk Climate, and be sure to subscribe and follow us on our social channels for the latest thought leadership resources and episodes on climate action and advocacy. From all of us at ecoAmerica and Climate for Health, thank you. Please join me in caring for our climate in order to care for our health. Stay well, stay safe, and get active. Thanks.
Thanks, Rebecca.